Hey Freedom Fighters, this is Dr. Peterson Pierre with America's Frontline Doctors bringing you today's Daily Dose. In a study published in Frontiers in Immunology, researchers from the Hospital of Ohio State University sought to find out if the COVID injections actually improved the outcomes of hospitalized COVID-19 patients. From March 2020 to November 2022, 152 adult patients were selected. 112 of them tested positive for COVID while the rest didn't. Furthermore, 23 of those who tested positive for COVID were jabbed while the remaining 89 weren't. What they discovered was a startling difference between those who got the shots and those who didn't. Mortality for the non-infected population was 36% and 27% among non-jabbed and injected groups respectively. But for the infected population, the non-jab subset had a mortality rate of 37%, while the injected subset had a shocking 70% mortality rate. Going deeper into the participants' backgrounds, researchers investigated the possible influence of comorbidities using the Charleston Comorbidity Index, CCI, a widely used analytical tool to determine the survival rate of patients with multiple comorbidities. They discovered that the CCI score was significantly higher in jabbed versus unjabbed patients. The researchers noted, quote, comorbidities and age are the known contributors to increased mortality among COVID-19 patients. Nevertheless, in our study, mortality remained significantly higher in the vax patients even after adjustment for CCI, suggesting there are other risk factors in vaccinated patients, end quote. The researchers also investigated the antibodies between the two populations. Interestingly, they discovered that the unjabbed subset had significantly higher antibody titers compared to those who got the shots. This discovery suggests a possible role of natural immunity. Remember natural immunity where they debunked that and said it didn't exist? Well, they were lying, as they were for a number of other things. Natural immunity in the protection against severe COVID. Furthermore, the researchers suggest that getting the shot can lead to immune tolerance, a process that makes your immune system less likely to respond to antigens such as COVID. Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.